Hello, and welcome to the Health Go Live webinar series. Today's episode is brought to you by our friends at Thoropass. We would like to remind you that the Q&A feature is available, so feel free to send in your questions and comments throughout today's webinar. We would love to hear from you. And with that, I will turn it over to our moderator, Tina Olsen-Grande.
Good afternoon, everybody, and thank you for joining us today. We're excited to hear from you all during our Q&A and really excited to hear from our distinguished panelists that we have with us today. We will be discussing on this webinar navigating 2025 and the key trends shaping healthcare compliance. We're excited to dive into what's happening on the regulatory front and how it's affecting the marketplace. My name is Tina Grande. I'm president and CEO of the Healthcare Trust Institute. HTI, as we call ourselves, is an organization based in Washington, D.C. We are comprised of healthcare organizations across the United States in all sectors of the market, and we focus squarely on health data policy issues through regulatory advocacy and watching market trends. And I'm very pleased to be moderating today. We have three fantastic people with us here. We have Mari Savickas with Chime. We have Laith Kanafsa with Thoropass. And we have Florence Luna with Fig Medical. I'm going to leave it to them to introduce themselves and their organizations, and then I'll pick back up. So Mari, how about if we start with you?
Thank you, Tina. Hi, Mari Savickas. I lead government affairs for Chime, and Chime is the College of Healthcare Information Management Executives, and we are dedicated to serving C-suite executives to rising talent at every stage of their health IT careers.
Great. And Florence, how about you next?
Thank you, Tina. My name is Florence. I'm the CEO of Fig Medical. We're a B2B health tech company focused on streamlining the prior authorization process for clinics and hospitals. Our mission is to improve the prior authorization turnaround time, reduce provider burden, and ultimately help patients get the care they need. Thank you for having me today.
Excellent. And Laith.
Hey, good afternoon, everyone. My name is Laith Kanafsa. I'm the managing partner of audits and compliance products at Thoropass. Thoropass is an information security compliance platform and audit firm. We help our customers implement and manage information security compliance frameworks and regulations, and then eventually demonstrate their compliance with those frameworks and regulations through industry standard audits. I'm excited to be here today.
Terrific. Thanks to all of you. And very quickly, just so our participants in this webinar know what we're going to be covering today, I'll give a very high-level overview of our agenda. We're going to start talking about the state of healthcare compliance this year and what's happening from a regulatory standpoint. We're then going to talk about how leading organizations in the market are handling this situation. We're going to talk about building on compliance as a business advantage. And then we're going to turn to a live panel discussion with our audience. And we hope for a lot of participation from our participants. And you can also participate through the chat function as well. We're also going to be posting a poll today. And the poll question is, what's your biggest compliance challenge right now? So that poll will be up for a good portion of the webinar. And please feel free to answer the question at your convenience as you listen in. So why don't we get started with state of healthcare compliance in 2025? I'm going to start with Laith here. How have you seen the landscape and approach to healthcare compliance shift over the past 3 years? And then I'd like Mari to follow up, but to talk to us about anything that's happening that Laith, from your vantage point, you don't see out there in the market.
Yeah, thanks, Tina. So I've been working with healthcare companies for maybe the last 15 years or so, and specifically over the last few years, really seen compliance in healthcare evolve from being a back office checklist activity to really a board level strategic priority. I think several factors really have driven this shift. The first is the explosion of digital health and AI. We're seeing health data being generated, transmitted, and stored in more places than ever before. It exists in mobile apps, it exists in wearables, it exists in cloud service or cloud platforms. It's really pushed compliance teams to move beyond static frameworks and adopt dynamic real risk management or real-time risk management. We're also seeing the rise in regulatory complexity. So state-specific privacy regulations are being introduced. Proposed updates to the HIPAA security rule and international frameworks like GDPR have required orgs to think globally, but really act locally. And the last thing really is the shift toward proactive security-first compliance. So the most forward-thinking organizations aren't waiting to be audited in order for them to adopt compliance. They're really integrating continuous control monitoring, internal audit functions, and automated risk scanning tools to make compliance more agile and operationalized across organizations. So really it comes down to a shift in culture. Compliance is no longer just about meeting the bar or checking the box. It's about building trust, enabling innovation safely, and being audit ready all the time.
Great. And Mari, I know you're right in DC and you're following this complex environment of regulations really closely. Any follow-up to Laith?
Yeah, I would just say that a few things. Like, we're definitely right now in a period of uncertainty. And as I was looking back over the timeline of what has transpired in health IT, it looks like things happen like in 5 and 10-year chunks. So 1996, next year will be the 30-year anniversary of HIPAA, which really kicked off digitizing data. It was the administrative side of data, but that was really, it seemed like such a sea, and it was a sea change at the time. And then we move forward to 2004 when ASTP, which arguably has gone through several name changes, but that position in office was created by executive order by President Bush. And that was, that's 20 years ago, a little more than 20. And so that kind of kicked off the advent of the adoption of EHRs and the focus on clinical data. And all along, security and privacy were in the background, right? HIPAA certainly is a bedrock of privacy and security in healthcare. Then we hit 2009, we have high tech, and that was for the funding, right, to kind of get things going. 2016, 21st Century Cures brings in information blocking, APIs, TEFCA, and then that brings us to 2025. And there's a lot of uncertainty, right, as the Trump administration 2.0 takes over, and they're still seating their appointees into the administration and departments. And so there is not a clear sense of direction yet around where they're going to go with the reorganizations and some of the downsizing. And so I think right now, none of us have like an exact crystal ball, but it does seem like there's a few little seeds and breadcrumbs that we can follow. And one of them, for example, is like, what will they do with the HIPAA proposed rule, which I think was just mentioned. And that is that's a question mark that was proposed under the final days of the Biden administration. And then the White House just released, they have a health technology ecosystem RFI, and sprinkled inside of that is really some focus like around access to real-time data. But laid across all of this always has to be privacy and security. So bringing it back to that, it has to be, you don't necessarily need the government to tell you, how to do your job or what to do. I just think that the things that we hear from our members are those who are resource strapped, that continues to be a challenge. They may want to do the right thing, but they're challenged. So just a few thoughts.
Great, Mari. And I know you were referring to the HIPAA security rule, correct? Not the privacy rule modifications.
Oh, did I say? Yeah, I meant, sorry about that. The HIPAA proposed security rule, which is proposed, everyone, not, well, I'm sure we'll get into that more, but yeah, not privacy.
Yeah, very good. And Mari, just to stick with you on this regulatory stuff, how do emerging privacy laws complicate US-based compliance efforts? It's going to be difficult with AI coming, down the pike here to, I think, do this in a manner if we don't have privacy figured out and we've got states introducing all these bills and passing laws at the state level. How does this complicate?
Yeah, while it might be nice to go sample like every type of chocolate in the chocolate box, it is very challenging for a provider and arguably other companies to navigate a complex web of varying privacy laws that might be overlaid with federal or even ones that maybe like say AI. There could be a variety of different overlapping, even at the federal level, there's as you know, Tina, there's overlapping rules like information blocking versus HIPAA, privacy. It's very complicated. However, it seems like we're seeing a trend that's pushing some of the effort over to the states, or when there's a vacuum, the states start acting. However, I think this is not like the last we're going to hear of it. And just to put a pin on it, you don't necessarily need to always wait for the federal authorities to tell you what to do. You want to continue to be on your journey and work with your vendors and other stakeholders to improve the overall cyber and security posture, even in the absence of certainty from the federal government. Even as you navigate multiple states, we're going to continue to push for a single, at least having a floor like HIPAA, right, where you start at one place. But right now it's a challenging environment. I know that the business leaders on this call have their own thoughts as they're trying to navigate this as well.
Yes, and that leads us to Florence. You're running a company in this complicated environment of health tech, and I'd love to hear how you're navigating all of this regulatory stuff coming both at the federal and state levels.
Yeah, absolutely. It's, kind of to Mari's point in terms of staying ahead of and really having a posture and being more proactive than reactive. So for us, it's really important to review and incorporate leading industry frameworks such as the AMA's AI principles. Of course, Chime also has AI principles, and saying what industry leaders who have worked for decades across this industry and who have seen how certain changes, to the mention of some of the regulatory frameworks that were developed around EHRs, and now there's this new wave of AI, and what are the frameworks that are going to come out of this kind of era. And so for us, emphasizing just evidence-based, transparent AI that supports clinical decision making, which is at the core of what we do, that prioritizes patient safety. I think for us, it's important that our technology not only enhances, of course, administrative efficiency and meets some of these product goals, but it also, we need to ensure that there is obviously the best cybersecurity practices, as well as bias mitigation and a lot of these other risks that come out of technologies that, and I mean, these risks, like, they may evolve with the kind of technology that comes out, but in today's world and in 2025, I think it's really, there's still going to be a lot of changes, but for us, and like Hamari kind of referred to HIPAA as kind of being the floor, like I totally agree that that's kind of at minimum, it's a great guiding principle, but there's still a lot of things here coming up in the future. And another reason why we're so thankful for Thoropass, like we're constantly emailing them and messaging them and just being on top of, this is how we're considering it. This is what we see out there. We're referencing a lot of these articles that are coming out and really kind of comparing our product and our technology to, what is kind of the best standards that we see out there. Even if it's not fully integrated into law today, we can imagine that it may be, and maybe it should be in the future.
Great. Thank you. And any advice, Laith and Mari, for startups up there out listening to us and in the marketplace, like Fig and others, on how to navigate all of this, both from a privacy standpoint as well as from a security standpoint?
Yeah, I think for startups, especially in the healthcare space, my top advice is you don't have to boil the ocean from day one. Start small, but start early. Don't wait until you're ready to scale to think about compliance. You can bake in foundational practices without massive overhead today. They'll compound over time and make formal certifications more smoother as you move down the path. And really leverage partners and automation. You don't have to build a GRC function or comply with regulations from scratch. There are tools out there are partners out there that can help you scale without really reinventing the wheel and starting your program from scratch.
Great. And Mari, any advice for the startups who might be listening today?
Yeah, I always like to leave people with something that they can do today so that it doesn't feel, to Leigh's point, like you don't need to eat the whole apple, and maybe you could just take one small incremental step today that would help you. And so just 2 small ideas would be following the Health Sector Coordinating Council Cybersecurity Working Group on LinkedIn, and I'm sure, Tina, we could get you the link for that. But it's joining it is free, and it has an amazing set of tools that are volunteer developed. So it's multi-stakeholder. So that's one thing. The other thing is we have a debrief, a Monday e-newsletter that also is free to sign up for. So 2 small, quick 5-minute steps that you can take that just get more engaged.
That's excellent. That's great. I think calling out some of those free resources is really great for these startup companies. So kicking it back to Laith now, we want to talk a little bit about how leading organizations in the market are responding to all of this regulatory sort of, it's not overkill, it's needed, but it can be burdensome and difficult to figure out. So Laith, how are healthcare organizations assessing and managing third-party risks in light of what's happening in Congress and in the states? There's a lot of third-party, connectors and B2B going on here. And so what are you seeing in terms of managing the risks involved?
Yeah, definitely seeing a shift. I think if you would have asked me 10 years ago, I think third-party risk was third-party risk, and that's how organizations treated it. But now really what we're seeing in the field is third-party risk is now first-party exposure. So it's becoming the problem of all organizations. The average healthcare org works with hundreds of vendors, and any one of them can be a breach point. I think we've all seen it and are familiar with it, but in the last couple of years, we've had SolarWinds breach, Change Healthcare incident, a MoveIt breach. So what we're seeing the leaders in the space are doing really is they're moving beyond simple vendor questionnaires for third-party risk. They're actually conducting real due diligence. They're looking at assessment reports and audit reports. They're requesting penetration test summaries. They're looking at sub-processor lists and understanding vendor incident response capabilities. They're also building tiered risk models. Not every vendor needs the same scrutiny. So critical vendors, those touching PHI or impacting patient care, require deeper assessments and sometimes even on-site audits. We've seen customers go on-site and audit their third-party vendors. And then also automating third-party management. So we're seeing increased adoption of platforms that can help you track your vendor onboarding, your risk scoring, SLA compliance of those vendors, and offboarding those vendors all in one place. So you don't have to keep, hundreds of Excel spreadsheets floating around on your desktop to manage all of your vendors. We're also seeing the regulators really start to pay attention. So the OCR, the FTC, and even the SEC are making it clear that you're responsible for your vendor ecosystem, and that third-party risk really is first-party exposure today.
So true. Yes. And it would be nice if reporting requirements were streamlined instead of sprinkled across all these different federal agencies. It can get confusing. And Mari, what are, from your standpoint, the biggest misconceptions about third-party risk in healthcare compliance?
Number one is that we're in control as a provider. We're not absolutely in control. And so I think that one thing that the companies consider is using security by design as a market differentiator, and that leading with that, because inevitably, to Faith's point, you're gonna, potentially this could blow back on you. And so really listen carefully when you're in contract negotiations about when you're asked to sign, say, a business associate agreement. Take that seriously. We are aware of instances where some companies don't want to sign the BAA, and even though they're touching PHI, or maybe go above and beyond and just do what would be required to comply as a business associate. So using security as something that differentiates you and sets you apart. At the end of the day, one of the things that we try to think about, we never try to position ourselves as the patient, but we are all collectively patients. We want to protect, right, the patient's information and their security and their privacy. And so the only way to do that is by working collectively. It's a team effort. So but providers are absolutely not in control. And then one last thing is we touched on this in our testimony last year. Our board chair at the time, Scott McLean, testified before Congress, and third-party risk was very much a conversation inside of his testimony and with lawmakers. It was following the Change Healthcare attack. So I think there's a lot of lessons to be learned there.
Yeah, I think, this third party, apps and things of that nature, it is, I think when you're living in the framework of HIPAA, it's hard for some of these covered entities to let go of that information into an ecosystem that is not regulated, even though they do have to do that. Legally, it is required if a patient asks, that information has to be handed over. And as I recall, NCVHS also suggested that it be made a mandate that covered entities audit their third-party vendors because it sometimes is not as common as we would hope it would be in the marketplace. So I think you're right, Laith, you had said regulators are really, and Congress are starting to think about this third-party risk element. And particularly, in that security world, it's being talked about a lot. So we know, since it is becoming more of a topic, there are new technologies that are helping organizations with compliance and audits and things like that. Laith, can you tell us a little bit about what you're seeing out there in the marketplace?
Yeah, I think we're kind of at this inflection point where technology can really turn compliance from a burden into a competitive advantage. And specifically, we're seeing the rise of AI and automation to help with streamlining compliance and audit processes. Specifically, tools now exist that can help auto tag evidence or types of data that you hold. They can validate your controls against frameworks or regulations like HIPAA, SOC 2, HITRUST, whatever it might be, and detect anomalies across audit logs in real time. So it replaces hundreds of hours of manual effort by leveraging those types of technologies. We're also seeing, workflow orchestration. So compliance, as everybody knows, is inherently cross-functional. It's all over your organization. It's not just one, business unit or org within your org that owns compliance. Platforms that integrate ticketing systems, policy management, risk registers, and audit logs into a single workflow really reduce friction and improve transparency across the organization. The key really is to treat compliance like a product, with user-friendly dashboards, proactive alerts, and tight integration with the tools that your team's already using. So it's really integrated into their workflow and process, and not a net new that gets kind of added on to their day-to-day job responsibility.
Yeah, that's all really important stuff. And I know, Florence, you're probably using some of these new technologies as you operate your business. And how have they directly optimized your ability to comply with the complex web of everything you need to track to make sure you're staying on top of things from a regulatory standpoint?
Absolutely. It's a great question. And I love just hearing everyone else's kinds of thoughts from kind of the different parts of the greater system that we're all collaborating in are coming from. So for us, leveraging automation and AI, like via Thoropass, has transformed our compliance operations. We use these tools to continuously monitor our systems. I think AI allows us to have like built-in kind of flags for certain things. And when it comes to regulatory changes, like there are new federal prior authorization rules around ensuring our solutions are electronic, interoperable, capable of supporting fast and transparent and accountable processes. These are the kinds of things that also require a bit of a human touch. And so I think that the very impactful thing for us with Thoropass is for us to be able to kind of tailor our compliance processes and these flags to meet the kinds of things that we have to do within our particular industry and prior authorization. And so that's been very important. So, as Laith said and mentioned, it reduces our workload and it improves efficiency and some accuracy, because compliance really does touch all of these aspects in our organization. But we still maintain and retain a bit of the human touch that is more tailored to our particular segment.
That's really great. It's great to hear that companies are taking these issues seriously and, really honoring and trying to be very good data stewards with people's information, and particularly their identifiable information. It's great to see companies like Fig Medical out there taking that really seriously. So now what we'd like to talk a little bit about, and Laith mentioned this briefly a little bit earlier in some of his comments, is how you can build compliance as a business advantage. It can really, if you can put yourself out there as a company that says, we're trusted, we're good data stewards, you can be sure that your information is going to be protected with our organization. That really, I do think, can be a business advantage when it's explained in a simple way to consumers. And Florence, in what ways do you think compliance can serve as a driver of innovation? Being a good data steward, instead of being a blocker. I think a lot of people, when they hear, oh, we've got to have either more regulation in the environment, or we've got to have more maybe steps involved in making sure that information is honored and protected, alarm bells go off saying this is going to silo information is going to get bottlenecked. How do you see this in a way that doesn't happen?
For sure. So I believe it's absolutely a competitive advantage as a business, but also the right thing to do for like the function that we are doing. And so obviously, principally, we need to protect like patient data. We need to ensure that we're delivering a safe product that is not exposing patient data or any really data that's identifiable either for the patient or the doctor or any party that our product touches. And for us, it's a bit of a mindset too. Like we've kind of operated on the first day, and we've spoken to other folks in the compliance space because we take this so seriously. And of course, we see things that are coming out. There's a lot mentioned here with change. There was even more recently Oracle. And we see these things that are happening, and it is scary. And as an early stage company, obviously we're dealing with a lot of different kind of competing priorities. But I think to someone else's point, I believe it was Mari or Faith, I forget, or Laith, I forget who, but there's this mention of like without compliance and without security, I mean, you don't really even have a business. And so so I think even to operate, I think it's table stakes. And so having a method and a channel with which you can do this and do this really right and thoroughly is extremely important. And so I see it as a competitive advantage, and it's what you promise in your mission and your vision to your customers, to patients. And I think it's kind of what you owe them as well as a business.
And it's not an easy question to answer, that's for sure. I mean, even this recent RFI coming out of CMS on the health tech ecosystem, you can see in that RFI that regulators themselves are struggling with this issue of how do we protect information without stifling innovation. So, moving more in the direction of that. Tamari and Laith, what's the risk of not evolving compliance alongside innovation? Making sure that compliance can keep up with the innovations that people are trying to do with health data, especially when we're thinking about AI and digital health. There's so much happening so fast right there. Mari, maybe we'll start with you. What's the risk of not evolving compliance along with innovation?
Probably a lot, Tina. The administrative burden, I think that was mentioned at the top of the call. There's so much, right? There's also a balance to that too. We need some level of oversight, right? But we want to allow innovation to flourish. But if you start building in the security by design at the top, right, then and you use that as a market differentiator, that would be helpful. I mean, there's a big risk to your reputation, but we already have a workforce shortage, right? So we need to continue to use some of the AI tools, for example, that are being used against us for ways to remove some of that inefficiency. And that will allow more, I guess, like air in the room or a little bit more light and more space for innovation to flourish, so that we've got that covered. We've got like some of those checkbox activities that are fairly they're not hard, but they may be time consuming. Just allow that white space to open up so that we can allow the innovation to flourish, and then we can apply some of those technological tools to tougher problems. So I think there is a balancing act here, but you do have to at the top of the stack of to-dos is prioritize privacy and security. And then once you've got that covered, then you can start peeling away some of the other layers. Like I definitely think that we're seeing AI being used, for example, on the security front to not only by the criminals, of course, to improve their attack techniques, but also by providers. And so vendors are being able to offer these tools that are improving their cyber posture. But again, at the same time, you still have to balance what you're requiring them to do with allowing the innovation to flourish. It's like a seesaw, I'd say. It's a tough act.
Yeah. And the federal government has recognized this a little bit, and we're starting to see a little more in the literature about privacy enhancing technologies. And it's another area where I think we could really help keep up from a compliance standpoint or from a data protection standpoint with the innovation that's occurring. Everything is happening so quickly, and these privacy enhancing technologies and techniques can be really, really great. Laith, how about from your standpoint when it comes to all of this AI and digital health, and what's the risk if companies don't evolve compliance alongside their innovative efforts or the
Yeah,
pace of innovation in the market?
yeah, it's a great question. I really think the short answer is if you're not evolving compliance alongside innovation, you're going to lose trust, market access, and operational continuity across kind of your base. We all want to be on the bleeding edge of innovation, but innovation without governance presents huge risk. If you're deploying AI models, as an example, on sensitive data without explainability, auditability, and bias monitoring, you're opening up the door to patient harm and really regulatory scrutiny at the end of the day. And it's almost like tech debt a little bit too. Compliance debt compounds. So if you keep building without structure, eventually it's going to cost you more to fix it than to build it right the first time. So really having that strong foundation is super important, especially as you're introducing new technologies into the space when it comes to digital health. And then you risk the risk, you risk the risk of reputational risk. We all know in healthcare, trust is currency. If your startup becomes the next headline breach or faces an FTC enforcement action, that's really game over for a lot of customers and investors. So a lot of these organizations, while we all want to be on the bleeding edge of innovation, needs to realize that compliance isn't the cost of doing business. Really, it's the platform that's going to make safe innovation possible. And if we're able to ingrain compliance from the very beginning to these new innovations, I really think we're going to be, we're going to build better products, but also create a safer world for all of our data.
Yeah, I think also even from an international perspective, the US being so far behind other countries when it comes to having a national privacy law, for example, we've heard from folks in our organization, for example, that it makes it difficult to do business overseas when, we're a nation that doesn't have a national law protecting people's data. So, Florence, back to you. How has establishing a really robust compliance program early, as opposed to waiting until it's necessary, been an advantage for Fig Medical?
Absolutely. I think, thankfully, due to a lot of the access to information that is now available for our customers, for doctors, and for patients, it's at the tip of their fingers. I think people are also aware of these dangers, and they're seeing the same kind of news, and they're seeing the same kind of risks out there, and so people ask as well. They want to know, like, how is this being protected? And so I think forthcomingly and again being proactive for us and demonstrating to them, like, these are the measures we have, like, these are our encryption standards, this is what you're working with when you're engaging with us, and this is how we're protected, and these are our fallbacks and so forth. And they're, for us at least, it's transparency again is very important for our customers, and I think that has instilled a lot of trust.
And to what degree does that have in terms of closing deals with other businesses? Do you bring that up as sort of part of the deal making process to distinguish yourself when you're trying to close a deal?
Yes, definitely we do bring up, the ways in which we are, our data is secure, and we do bring up like our encryption standards. We more offer it as like this is how we operate, and this is how our product and our data is protected. Because once again, for us, transparency is very, very important. And I definitely, I know at least in one instance because people are so aware like of what the risks are, they definitely have been like, oh, they've asked for further information, oh, and how are you encrypting this, or how are you protecting that? And we thankfully it's like also the tip of our fingertips to access it, thanks to Thoropass, where we can just say, here's the policies we've developed, here's how it is secure, and we can deliver that back to our customers.
Very good. Laith, so throwing it back to you, for companies that are manually and laboriously handling compliance and security, do you have any tips for how they can integrate that difficult and burdensome process into their existing systems?
Yes, I have many tips, but I'll try to keep it short for this specific segment. I would say the first thing is there's no need to rip and replace your current systems that you're using. The organizations that are most successful in integrating into existing systems, the first thing they do is they start with discovery. They map out their current tools, their current workflows, their current tech stacks, and they start figuring out what are we tracking in spreadsheets, what lives in Slack, what lives in Jira, what lives in Confluence, and they kind of draw or build an integration surface area to really understand which existing systems they're using and what they're used for. They then should go and automate kind of the low-hanging fruit. So you don't have to start with the most complicated thing. We actually recommend you start with the least complicated thing. So you start with controls that are objective and frequent, but also are high stakes. So controls like access reviews, figuring out who has access to what systems and whether or not that's appropriate. Doing things like encryption management and backup verifications, making sure that you're actually backing up data. These are the objective controls that are low-hanging fruit, super important, but really easy to automate. To the extent possible, we recommend you use APIs and not necessarily manual uploads. So many modern compliance platforms today can integrate with the majority of the tools that organizations are using, including their HRIS provider, cloud service provider, ticketing system, messaging platform, documentation storage system, whatever it might be. This helps reduce the context switching and really lets your team stay in flow and focusing on their job. And then last but not least, iterating and just measuring over time. You shouldn't aim for 100% automation up front. You want to aim for progress. So tracking the hours saved, your audit readiness scores, your issue response times, and build momentum from there. Ultimately, compliance is really a team sport. It's the entire organization's job to make sure the organization is compliant and abiding by frameworks and regulations. The more you embed it into your existing systems and your culture, the less it feels like a tax, and the more it feels like a business enabler.
Excellent. Yeah, that's a lot to keep track of, Laith, and it's no easy undertaking when you're handling a lot of data, and a lot of it is very sensitive in healthcare, to make sure that you're abiding by what rules are out there and learning what the best practices are in the market. And I know we have a couple minutes here before we go to Q&A, and I did want to ask a question that we haven't discussed yet, but it's huge, and it's what's happening in the states. The federal government has long tried to pass a national privacy law, and they have not been successful. And what's happening is we're seeing governors and state legislatures getting frustrated and saying, okay, well, we're going to protect our own citizens' population information and pass our own law that is just for our own state. And we've got 50 states out there. And if all 50 states develop their own unique laws in privacy and AI, things could get pretty complicated pretty quickly for organizations that operate across a border, which I think most tech companies do not restrict themselves just to one state. And Mari, I know you're sitting right in the nation's capital, tracking all of this, from the standpoint that the feds aren't doing this. So what's happening? It's all out there, in the states. What's your opinion and the impact of all of this and how interconnected all of, the tech world is in healthcare right now?
Yeah, I think what are we up to, like 20 states, I think. I don't have the latest count, but I believe it's somewhere between like 15 to 20 states have their own privacy laws, and it went kind of quickly. It went from I'd say the last 3 years, it just has blossomed into the kind of activity. And so it's probably new for companies to try to navigate this, and it's hard. I mean, I think some of the, I'm just trying to think, we mostly focus on the federal piece of things, but things that have popped up would be like consent and opt-in and opt-out. And it's so complicated to manage this. And those are sticky issues, right? Which I think is why one of many reasons, there's so many reasons why it hasn't been passed at the national level, but it makes it infinitely more complicated. Like if you're in maybe like a tri-state area, or I'm in Virginia, but I work in DC, and then we have Maryland. I mean, can you imagine being a provider who's trying to service like the area, like the district's a district, but you know what I'm saying? Like it's very complicated. Like, just a personal example, you want to do telehealth, you might have to cross a border to actually take a phone call with your provider. You're telling them like, oh, I'm actually like in DC when you're really not. You know, I mean, I'm not saying I did that, you know, hypothetically speaking, but you know, like get in your car and drive across the state line to take because that doctor's maybe not credentialed. I mean, you can see how complicated I know that's going off in the telehealth space, but it is one example of how complicated having multiple state rules is, and just having a single set would be so much easier. And then one other thought too is like HIPAA is a floor, so they can always go higher, which I guess we haven't fully navigated. And, you know, unless there's like, you know, if they have state preemption, meaning, you know, the feds are like the only game in town, which we're not going to get that. So I think you're going to be stuck with like a lot of different laws and flavors of privacy that we're going to continue to have to navigate. Long answer.
It's really difficult and
Super difficult.
very difficult. I don't know if you've run into that, Florence, with your startup, if you've had to jump through hoops to comply with varying states' privacy or AI laws.
For us, what we've more actually seen is some progress being made in terms of standards as it relates to prior authorization, transparency, and interoperability across some states versus others. And that actually we like to see, but you know, I believe in the same way that some of these privacy laws have developed very quickly over a short period of time, that the same will happen with prior auth, especially given all of the highlights that have kind of all the spotlight that is on this particular operational administrative workflow. And so I do think progress will continue to be made across more states.
Yeah, and Laith, anything from your vantage point on this patchwork of states that are introducing their own privacy and passing privacy laws and AI laws?
Yeah, not much more to add that wasn't said, other than it's just going to make everything so much more complicated if things are adopted on the state level versus kind of a national law. We're seeing it today where businesses are really curious about what's happening in every state. They're constantly asking us questions, wanting the insight because they want to remain compliant with whatever regulations are out there. So it could really cripple a business if this thing isn't solved on the national level here soon.
Yeah, differing definitions for personal data or what's considered de-identified data. I mean, there's, you know, consent that Mari mentioned. There's so many different just areas in policymaking that can really trip up, I think, the ability to have seamless ability to share information across state lines when you've got differing definitions and things of that nature.
People tend to drop down too to like whatever the most strict requirement is out of an abundance of caution. I mean, I don't know if you experienced that, Florence and Leif, but that seems to be what the providers have to do is we'll just go to like the most extreme or the most strict example, and so that we don't do the wrong thing.
Yeah, absolutely. And I think I see that a lot, and we're constantly sending articles that we're like reading to like Thoropass. I'm sure, Laith, you've seen your team. We're like constantly saying, you know, this just came out. Does, you know, now what does that mean for us and how we're applying this here? I believe we should now do this, and then we continue to kind of tailor our posture. But I agree. I think that is what folks should do. And not all providers, like we visited some clinics, it's one or two providers, and you know, they might not know about some of the progress that's coming out in some states. And oftentimes then it's also like an educative opportunity as well as just the right thing to do.
Great. Well, we can start now with our Q&A, and we've got, looks like a good number of participants with us today. We'd love to open it up to Q&A. You can either put your questions in the chat here for all of us, and we'd love to answer any questions that you might have. Give folks some time. And if we don't get any, I certainly have more questions that I can ask, but we'd love to let the audience have a shot at asking questions. Okay. Oh, and we have a poll result. All right. Well, as people are thinking or writing their questions, let's talk about that poll result. So the question was, what's your biggest compliance challenge right now? And sure enough, it is keeping up with evolving regulations. That was the most selected. And I think, it's not only, I know that Laith brought up at the federal level, you've got the FTC, you've got HHS OCR, if you're in the HIPAA realm, and then if you're publicly traded, you've got the SEC. You've also got CISA and a CIRCIA rule. I mean, there's just so much happening. And then that's just at the federal level. On the state level, you've got 50 states that are passing privacy laws or passing AI laws as well. So it's got to be hard for a startup to keep track of all of this. And glad that Thoropass is helpful to FIG in this way. Let's see. It looks like we do have a question from the audience. I'm just trying to find it. I don't see it here.
Me to read it for you, Tina. And then
Oh,
I think it might be more for Faith and Florence. I can read it if you can't find it.
you know what? I found it. Thanks.
Okay.
Sorry. Yeah. Okay. We've got two, it looks like. First is, as regulatory requirements continue to evolve, how can smaller or resource-constrained healthcare organizations prioritize which compliance processes to automate first to maximize both risk reduction and return on investment? Who'd like to take that one?
I can take it. I think especially for smaller organizations that really, don't have the resources necessarily to automate everything, I want to maximize kind of their risk reduction, their return on investment when it comes to implementing some of these tools. Some of my advice really is to start with the low-hanging fruit. Typically, the low-hanging fruit is actually where most of the risk exists and the easiest to automate. I think I mentioned it earlier, but controls like, your access, knowing who has access to what systems and whether or not that's appropriate, ensuring that encryption is turned on for any data stores that contain sensitive information, making sure that your servers are up to date, your patch management processes, clear and concise, having some type of data classification where you're classifying specific assets throughout your organization. Typically, these types of controls are the easiest to automate, but also the greatest ROI when it comes to reducing your risk within an organization.
Great. Lots of nodding there from Florence. Did you have anything that you wanted to add?
No, I resonate with all of the above, and it's things that I'm pretty intimately familiar with.
Great. Good. And I know that Mari had mentioned some free resources earlier. And I think, that's really, that HSCC forum is a great place to be able to sit with, wow, what is it, Mari? I mean, it's like 100 other organizations or more, and just literally hear what people are going through and learn just for free in a public-private partnership. That's another great place to get information. So we have a second question, and maybe we'll start with Mari on this one, and then Florence and Laith, please chime in. But what challenges do you see in the future with telemedicine? And Mari, you had briefly mentioned that earlier.
Yeah, I didn't mean to go off the reservation. That was just the example that came to mind immediately. With telehealth, I think the challenge is going to continue to be, at least at the federal level, is the funding. That we're just right now, it's so expensive to extend the telehealth. And so if you're following the budget reconciliation process, it's a little bit of a nail biter trying to watch them move that through Congress right now. And so when every, dollar counts, and as it should, it's just hard to find the funding to push that forward. And so I think we'll probably see a situation where they just continue to fund it for a short period of time, even though we ask for it to be longer. It's going to be hard. Right now, it's set to expire on September 30th, unless Congress acts, which I think that they'll act. I just think the bigger question mark will be like, for how long?
Right. Right. And telehealth is so popular. I assume they will try to find a way to include it in the package, but like you mentioned, where do you find the money, Mari, when we're in an environment where we've been downgraded by Moody's and all of that stuff? It's not easy. We have, anyone else want to answer anything on telehealth before we move to the next question? Nope. Okay, we have another question. How can we quantify and report compliance-related ESG metrics? For example, health equity audits, cybersecurity posture that investors are increasingly demanding. And maybe Laith, we should throw that one to you.
Yeah, it's a great question. I think you first want to start with defining and aligning the specific reporting standards. So really understanding, what investors want to see, and what are like the specific KPIs that are most interesting to actually report on. Once you're able to define and align the reporting standards, it's important to collect, quantifiable data. And I guess this depends on which area you're looking at reporting at. So if it's your cybersecurity posture, as an example, being able to report on things like, compliance controls, how many are actually compliant, maybe the number of audits passed or failed. An important one that we're seeing increasingly more and more is the time to actually respond to an incident or a threat within your organization. And really coming up with those specific quantifiable data that you're able to report on regularly. And then being able to really automate and monitor the actual reporting with tooling. So you don't want to have to always, collect the data manually, have a team work on the data for the actual reporting. You want some type of, whether it's exec level dashboards or there are plenty of tools out there that will help you kind of collect the data and report on that data. Those are kind of, I guess, the quick hitters that I would suggest you look into, especially for investor demand.
That's great. Anything from Mari or Florence on that question?
Maybe, and this is probably already being considered, but start with the process measures versus like the outcomes. It's harder with cyber, right? With process, like how many cyber, incidents have you been able to thwart versus like, I'm not going to think of an outcome one right now, but that would probably be the first thing that comes to mind.
Mm-hmm. Very good. Well, this has been a really fascinating conversation, and I'm so glad that we had folks from the audience sending in questions for all of our panelists. You all are such experts in what you do every day, and you do such different stuff, and it's really neat to hear from these different viewpoints on how to stay compliant in a really complex environment when it comes to health data. And Laith, I'd like to throw it over to you. I know you've got a couple things to leave with folks before we sign off here, so I'll turn it over to you.
Yeah, thanks, Tina. Look, we get it. Healthcare compliance is really complicated. The regulators don't make it any less complicated for us to navigate. And we've built a solution to really help organizations streamline their healthcare compliance, especially when it comes to industry recognized frameworks and also the specific regulations. If you have any questions or are looking to streamline and simplify your healthcare compliance journey, please reach out to Thoropass using the link that we'll provide you right now, I believe, in the chat. And if you're not ready to necessarily talk to an expert yet, but have a little bit, have some questions or need a little bit more info on the specifics of healthcare compliance and the current state of healthcare security in 2025, you can download our healthcare guide from the chat as well. It was really nice to talk with everyone today. Really appreciate you joining and your attention, and we look forward to talking with you soon.
Thanks, everybody. And I think the takeaway from today is don't wait. When it comes to compliance, just dive in and reach out to, the folks on the panel here or wherever to make sure that waiting will be too late and will cost you more than maybe it would have otherwise to be up to snuff. So it's great to hear from all of you. Thank you so much. And I hope everybody has a wonderful afternoon.
Thank you to Thoropass and to everyone that joined us today. Please visit our website at community.hlth.com to catch up on all Health Go Live webinars and watch the recording of today's session. Join us in Amsterdam June 16th through 19th for Health Europe.